startling new statistic from the CDC offers more grim evidence of the serious health risks facing people who are not vaccinated against COVID-19. So here to answer that question and many more is Dr. Todd Halloran. He's the Chief of Infectious Diseases at South Shore Health. Dr. T, it's great to see you.
Good to see you, Doctor, as always. So you've told us many times before, right here, that the vaccines save lives, and now we're learning people who aren't vaccinated, according to the CDC, are 97 times more likely to die from COVID-19 than people who received their booster. That is an enormous number. So is that consistent with what you're seeing at South Shore Health?
It absolutely is, Maria. And the term I'm going to use is res ipsa loquitur. It means the situation speaks for itself. This is obvious. The CDC data is compelling. We've heard about this now for years, that more than a year, that vaccines are saving lives. In the CDC study, the risk of dying if you're unvaccinated is 100 times more than if you are boosted. And the bottom line is we are not seeing patients entering South Shore Health who are dying of COVID who are boosted. We are not seeing boosted patients dying of COVID.
Doctor, the numbers are staggering, Dr. T. They really are. All right, we want to show this graphic of the 7-day average of daily new cases here in Massachusetts. Right now, it's around 3,300. Less than a month ago, it was 23,000. Obviously, in comparison, that's a steep drop. So how close are we to a level that you would consider, to use the word, safe?
Well, Eddie, you guys mentioned this before. It is declining right now, and the curve looks like that ice pick. So that's good news. But remember something. What's safe for someone may not, a younger, healthy person may not be the same as someone who is elderly on chemotherapy. So I think safety is in the eye of the beholder. The good news is cases are declining. Overall, the Omicron variant is milder than previous variants. We have more population immunity, but we still have to reach more population immunity to protect ourselves for the next variant to come.
You believe that there will be a next variant then?
I do. You know that, Maria.
I know. I just wanted to confirm it. I was just being hopeful that you would say no, but our viewers are emailing questions every day. Let's get to this one right here. This is from Jaden. How come we don't hear about the flu anymore?
That's a really good question, Jaden. And I think the bottom line is last year, we really didn't see any influenza. Was historically low. This past fall, as Delta was declining, we started to see an increase in influenza that frankly met an average year in cases. So there was an increase. Then around Christmas time, as Omicron was increasing, influenza has really, I don't want to say disappeared, but fallen again to very low levels across the United States. This may have to do with our behaviors, more masking, as we saw that surge again in the next variant. It may have to do with viral competition. When we see increasing levels of COVID-19, perhaps we don't see as much influenza. I think it's good news, but we still want to get the influenza vaccine. It is important because we don't know if influenza will still rear its ugly head as Omicron declines and as we start to take off our masks.
Dr. T, thanks for your insight. Have a great weekend.
Take care, guys.
Thank you, Dr. Be well.